Hi everyone, my name is Clémence Dallaire and I'm a professor at the Université de Laval in Quebec City, and I also I am the chair of CASN Research and Scholarship Committee. It is with great pleasure that I welcome all of you to the April session of the 2019-2020 Lunch and Learn series. I'm sure many of us are familiar with the concept of the lunch and learn, where faculty members come together during their lunch hour to share with one another projects they are working on, and to dialogue and discuss methodology, successes, and challenges they encounter in their work. This webinar series is intended to serve as inspiration and a networking opportunity for participants while recreating the collegial feel of the lunch and learn. This year, each session will highlight one of CASN national research priorities for nursing as a team. Today, for this second session of the 2019-2020 series, the theme is Nursing Research Priority number 7, Nursing Education Outcome, and we will hear from Dr. Judy Boychuk-Dukeshire. After graduating with a diploma in nursing in 1989, Dr. Dukeshire's early career was focused on developing expertise as a direct care nurse, researcher, leader, and educator in cardiothoracic and high acuity contexts. Instrumental to her early development was a 10-year tenure developing and coordinating heart, lung, and multi-organ donor transplant teams across Canada and the United States. Today, Dr. Dukeshire holds associate and adjunct faculty positions with the University of Saskatchewan, University of Alberta, University of Hawaii, and the University of Western Sydney in Australia. For the past 21 years, Dr. Dukeshire has been an active researcher and consultant in the area of new graduate professional role transition, work for which she has received over 32 national and international grants, awards, and scholarships. The findings of her research have generated a theory of transition shock and a model of the stage of transition, resulting in a publication of more than 18 peer-reviewed articles, 2 books, 8 book chapters, and the delivery of over 250 keynotes and workshops throughout Canada, the United States, Australia, and Asia on the topic of new nurse integration. Dr. Dukeshire founded and acted as the executive director of a federally registered nonprofit nursing organization entitled Nursing the Future, that served as a bridge between the ideal taught in undergraduate nursing education and the realities of the real world of professional practice. As an associate professor of nursing at Thompson River University and an international expert in the area of new nurse transition, Dr. Dukeshire maintains that it's the vision, creativity, and passionate commitment of this young professional, supported by the expert knowledge and practice experience of their senior mentors, that will drive nursing and healthcare forward. Now more than ever, during the time of an unprecedented global pandemic, do these words resonate as true? During today's webinar, titled Providing Safe Passage, Dr. Dukeshire will share the work she has undertaken in the area of new graduate role transition and how our newest nursing professional might be affected by the current context of practice. In her presentation, she will address the following question. First, how can we prepare and support new graduates to transition to the workplace most effectively? Second, how might the dynamic and intense climate of healthcare influence the primary elements of a new graduate's transition? For example, stability, consistency, predictability, and familiarity. Third, what aspects of a new graduate entry to practice might be affected by the context of this global pandemic and how? And lastly, how can we use this current situation to revise how and what we teach students moving through their undergraduate education? After Dr. Dukeshire's presentation, we will have time for questions. but while she's presenting, you can submit question. Please use the question and answer function on your screen. Once you have finished typing your question, please don't forget to hit send, and I will accumulate the question and ask them after the presentation. But Dr. Duckshire invited me to interrupt and ask any question that you might raise while she is presenting. So now I will turn the session over to Dr. Duckshire so we can begin.
Thanks
It's
so
up
much,
to you.
Yeah. Thanks so much, Clemence, and welcome everyone. It's just such a privilege and a pleasure to be here with you online. I can't see all of you, obviously. Oh, someone's playing with my with my slides. Okay, I'll do it. No worries. Thanks for that introduction, Clemence, and I just really want to start by saying I hope everyone is healthy, and that those that you care about are healthy, and that you're all safe and staying away, so that we can all be out of this situation as quickly as possible. And I'd like to talk to that Chinese individual who said the following: "May you live in interesting times." That was a Chinese proverb. Who would wish for such a thing? So anyways, it's a pleasure to be able to be here with you, and I want to talk. Someone's moving my slides, and I'll just move them myself, just so people don't get nauseous. All right, I guess I'm here to talk to you about the transition experience for newly graduated nurses. It's a topic that I'm very passionate about. I've been working in this area for over 20 years now and conducted 8 studies. One I joined with a colleague in Australia to do a review of transition residency programs, and the rest were my own research projects. I currently have a research project just finishing on new graduate transition, and have paired up with a group in Australia to conduct some work on residency programs in Australia. So it's an exciting time to really be thinking about new graduate work. This is certainly, it doesn't get more real than the environment that they're going into right now, and that's, I think, what is motivating a lot of people's interests in new graduate transition. So I just want to start by offering you these 2 quotes. You know, this initial quote was early in my research, and graduates often describe this as the hardest thing they've ever had to do, was make that transition from being a student to being a professional nurse. And then I just thought I would add this one, which is from the most recent study. And it kind of gives you the lens of anxiety on the experience of the new graduate transition. And I think that that's very appropriate for our discussion, because I think the level of anxiety and tensions within the workplace today are probably going to be a lot greater than they have been in the past. And how the new graduates are transitioned, I believe, will be very important. I think that there is, certainly this last study that I've done has demonstrated or revealed, I suppose, that there is a different kind of graduate out there. You know, you always get there's always a curve, but I'd say the bell part of that curve has shifted. And I feel a bit concerned about the level of stress and what that will mean for these new graduates' willingness to put themselves in harm's way, number one. Number two, to be able to manage and cope with the stress that they're going to need to be able to do to continue on through their transition into a safe professional space. So when you think about what the research says about new graduate transition, my colleague Kathy Rush from UBCO and a colleague of hers there, Robert Yankee, who was actually one of the chief librarians there at UBCO, and I we're able to do an integrative literature review on new graduate transition support programs and support initiatives. And so some of what I'm bringing to you is 20 years worth of review of the literature. And we know that the new graduates are going into acute care. That's primarily where they go. That's usually just a result of the job availability. There's not as much work in home care, for instance, or outreach or community or public health than there is in the acute care centers, and that's just a matter of numbers. The workplace is increasingly acute, and there's, I don't think anyone on this call who wouldn't understand that, and certainly what we're experiencing now is tantamount to a tremendous increase in acuity, complexity, and chaos. The new graduates generally, when you think about it, they don't have a lot of experience working in teams. They work in relative isolation or pairing with their faculty in the workplace. So they're not as accustomed to that whole idea of relationships on teams, a balance of workload, things like that. The opportunities for learning delegation and supervision of unlicensed staff and how to work with, for instance, licensed practical nurses is not as available to them. And we know that our environments are highly complex and chaotic, certainly more so now than ever. And knowledge is often incomplete, and that's sometimes for those of us in the practice area, it's what we love about it. It's what we love about nursing is that you never really know what you're going to find. Well, that's not terribly welcoming to a new nurse who's looking for stability as one of the cornerstones of their experience. And we'll talk about that later. We do tend to talk, and we should and we need to balance the knowledge that we give students in their programs. We have to make sure that we are reflective of the move toward a primary healthcare model in our country, and I would hope globally. So it's important for us to keep up with that, but the challenge is that they're not necessarily going into a primary healthcare focus. They are going into a more biomedical and fiscally driven experience, and so there is some disconnect there that I think is just the way it is and the way it's always going to be. And I'm not sure that we're ever going to be able to fix that. This tension that occurs between the ideals of education and the realities of practice. I think it's a really important tension. And I think I say that because we can't teach only to the ideal. That's not practical. And we can't teach for the pure level of practice that exists, because we always want to teach to try to achieve something a little bit more than that, and we want to inspire and encourage those moving into practice and those in practice to always think about elevating the level of practice, elevating the level of dialogue. That's what we're all doing as educators. But there's a balance there, and I think we keep each other in check, and I think that's an important tension that's always going to be there and maybe always should be there. So just introducing you very briefly, because I'm sure some of you are familiar with this work, but the stages of transition are essentially three. Within the first stage of transition, which the new graduate is very focused on what they're doing and what tasks need to be done. And that's why I called it the doing stage. Within that stage is something called transition shock, and it's become a point of incredible interest for healthcare sectors. And that's kind of, I'm finding, where a lot of the desire for knowledge is coming, is in that initial stage where they're going to be facing these incongruencies, and when their stress level is probably going to be the highest, and they experience this disconnect between what they thought nursing was going to be, what it is, what they thought they were going to be able to do, and what they're able to do within the time and fiscal constraints of the practice context. And so then they move from that first stage into the second stage at about 4 months. And again, this most recent research that I'm doing has lent an interesting lens to this idea because, I'm not sure that I can make a commitment as to whether or not or why the students might be, or the new graduates might be delaying or trying intentionally to slow down the experience of transition. But a lot of them, I'm finding, are not wanting to jump into full-time employment. And I feel like they are hesitating to go into that environment, whether it's because they're overwhelmed and they just sort of try to back away from that which is overwhelming them, which makes perfect sense, or whether or not they just don't have that, dive in and make it happen ethos as they move into work. I think it's a bit of both. So this idea of moving from one stage to another has become for me about hours and not as much about time, because some of them are not getting to this second stage until they're at about 8 months because they're not working. And when they are working, when they are kind of, in my traditional model of months, if they're working about a 0.75 or more, they progress through these stages in a matter of time. But it's not that way with some of the individuals who are delaying their movement through the different stages because they're not working the same number of hours. And I don't think it's as simple as just the number of hours, because it's the number of hours within a period of time I believe is important. So this has introduced a new element into my work that I'm just starting to think about in this particular study. So at approximately 3 to 4 months of 0.75 to an FTE, they'll move into that second stage, and that's assuming they had a decent first stage. That's assuming that their shock experience was able to be mitigated in some fashion. And they can move into this second stage where they're not as focused on what they're doing, but they start to kind of step back and take a look at the context within which they're transitioning, and they start looking at that context and they start to question it, and certain things start to be revealed to them about that context. And I think the second stage is really important in terms of the graduates' decisions about practice. I think they're making a lot of decisions in the second stage that they may not even be aware of as they examine and they doubt and they question. They subsequently come to some conclusions about that. So I'm going to come back to that later when we talk about how do you support these grads through this experience. And then if all goes well, they'll move into this third stage that takes them to approximately a year's time. And in that third stage at about 8 to 12 months, it's a nice settling out period for them if they've had a successful transition through the prior two stages. And it's more about recovering, and they start to see larger picture ideas. And this is where they start to think about, where are they going? What are they doing? And hopefully they've had some nice recovery. So this just gives you a sense of on the left is the stages, and on the right is the way they're navigating their complexity. And you can see that it's a highly dynamic and quite frankly emotional experience for them in that first stage, whether you see it or not. It's going on under the surface. And in stage 2, there is a level of exhaustion that, because so much energy has been spent just trying to sort out all the relationships and processing information and trying to do all of that without giving anyone the impression that you are at all unsure or anxious. Because of course the graduates don't want other people to know that they are feeling anxious, that they're feeling insecure, that they're feeling incompetent or inadequate. So in the second stage there, and this study has revealed this as consistently as my other studies, this crisis of confidence at about somewhere between 6 to 8 months. I think it's about the graduates getting to another level of understanding and feeling confident, but then being pushed to make decisions, because the people around them are like, okay, so you've been here for 6 months. let's move you a little bit further along the line. And then again comes that level of anxiety about, oh, I don't know if I can manage this next level. And I think that's what the crisis of confidence primarily is. So the transition shock experience, there are certain things I just want you to be aware of before I move on. And that is that initial transition shock experience can occur immediately. It can occur after the orientation, which is interesting because people are like, well, we're going to prolong your orientation. And in some ways, that's a really helpful thing. But in other ways, you're also delaying the experience of the full weight of responsibility on that particular graduate, which is contributing to that shock experience. So at some point, they will experience something like this. And the degree will be relative to that particular grad, their level of maturity, their previous experience, the way that they are, their personality. So transition shock usually occurs within the first few weeks, and it can last, some honestly have difficulty getting through it because they're not supported through it. They may sever the experience because of the transition shock, and then when they go back in, they experience it again and again and again. So this is just, I think, one of the reasons why it's so important that those who are out there supporting them understand their experience. Because if they don't understand their experience, they may be guiding them in ways that are actually counterproductive. And this idea that you are having these experiences is normal. And if we can find a way toward normalizing it and supporting them through it, as opposed to we got to try to prevent that transition shock, that's just not going to happen. And so I encourage people to be aware of the reasons why they're having this transition shock and then try to help them through it. Now, not only are there stages of transition, but there are phases of transition. So you can see here that, and the reason why it's not just about, okay, now you're in practice, I'm done, we're out of here. No, the interface between preparation and entry into the workforce, I think, is a really important one. And it's a very complex situation because these are students who've gone through upwards of 4 years, perhaps more, perhaps less, depending on the program. But they've gotten to this point where they have figured out what their education is about. And they are really, at a certain point, just want to be done with their education. They want to move on to the workplace. So they're not at a place where they're necessarily malleable. They have made decisions about what they want to know about practice, and introducing new ideas like, okay, just so you know, this is going to be a bit stressful. Well, who wants to hear that after you've been in education for 4 years and you feel like, I thought that was all done. I thought my stress, my whole working my butt off to get here, that was going to amount to a paycheck. I can go on holidays now. I'm going to enjoy my work. I'm going to be able to take all the responsibility and get all of the credit. The other side of that this is a completely new experience, is something that they don't always want to entertain. So that preparation piece has been problematic for a lot of educational institutions. And there's lots of things we can talk about, and I'll talk about them later in the presentation. But then they go through these other phases, and the orientation phase is interesting because a lot of that, depending on how it's structured, but a lot of that can be very familiar. If they're in a classroom, if they're still learning, if they don't actually feel the full weight of the responsibility, the orientation can feel very much like school. Then they move into the transition where at this point, they're probably being afforded the full weight of their responsibility. And this is when it really hits them. And that may or may not come early on. It may be delayed for a couple of months, depending on how much. Amanda says, I feel like this happens every time I enter a new role. And it's true. Their transition is not a new concept. It's the fact that you don't have a familiarity with this transition that is somewhat problematic for these young graduates, is that they've never actually been through that. And, I have to be honest, you'd think I would know a little bit about transition, considering I've studied it for so long. And I remember I went to a new position, and it was in a new city. I didn't know anybody. Um, it was a new faculty, and I remember the stress that I was experiencing was just mind warping, and I was so anxious all the time, and I said to someone, a friend of mine, I said, I don't understand why I feel like this. And they thought that was pretty funny. And they're like, well, you're going through a transition, Judy. Um, and of course, I mean, now I see several people mentioning Benner. So just remember that Benner's framework is primarily a cognitive and skills framework. So that's where there was an article recently. I think Melanie Murray was the one who published it, and it was a description of how my theory of transition and Benner's skill competency framework are used really well together, and they are, and it because my transition framework is intended to speak to the relational, contextual issues, and not just the cognitive progression of the new graduate. So when you use it in combination with Benner, you get a really nice rounded approach to new graduate transition. So thanks to those of you who brought up Benner. So anyway, just finishing with this, just to give you, to give you a sense that that there is a degree of phases that the new graduate will go through in that first year as well. So I want to talk about the foundational elements of transition. So I've identified 4 foundational elements that have to do with the conditions required for that new graduate to be successful. And the first is, and all of them result in success. So the more unstable, inconsistent, unfamiliar, and unpredictable the environment and the experience of the new graduate, the less success that they will likely experience. So when I think about stability, I'm talking about how steady the circumstances or situations are, how much change is occurring, and how much control does the new graduate have over that change. And then predictability is, what am I supposed to know? Do I know what I'm supposed to know? Do I have a sense of who I'm going to work with, where I'm going to work? So this is where the concept of floating does not necessarily provide a lot of predictability for the new graduate. In a basic predictability model, you are able to identify and control the circumstances within which you're placed. And in a float situation, you often come to work and you may be at one of 5 units. And if you're new to all those units, that can be really uncomfortable. Familiarity, and again, you can see that there are relationships between all of these. So the less predictable it is, likely the less familiar it will be, the less stable it will feel. And perhaps if you can't predict where you're going to go, there's less consistency in where you're going to go. So familiarity is, how well do I know the roles, relationships, responsibilities of that particular area? And this is where the experience that those senior students have just prior to moving into their transition is very important. Knowing the people, knowing even where to find things is a mitigating factor. So familiarity impacts on their transition significantly. And then consistency is simply, how often am I exposed to particular situations? And I'm hearing from the new grads in my current study with the COVID situation is that their units are changing. So they may have gone into the unit for a particular demographic of patient, and now that unit has changed. So the consistency of the patients is changing, and the ability to predict who you're going to get on your unit is much less. So that's one thing that's happening. Categories of influence are simply, what are your roles, responsibilities, relationships, and what knowledge do you need to have to function well as a new nursing graduate? And there's, again, you'll have a copy of these slides, and certainly there's lots of information out there on this if you desire it. I just wanted to mention that this is not just an intellectual experience. it is also social, it's developmental, it's emotional, and it's physical. I mean, these grads are working nights when they've never worked nights before. They're having to interact on a relational, professional level with people that, you know, we all have our own personalities. We have to work with different disciplines that we may not entirely understand the relationships that have been established on our particular workplace. We don't necessarily know, you know, who's who in the zoo, and, you know, who can I trust? Who should I stay away from? We don't know that yet. And it's very emotional. I mean, these grads are hiding. It's like an iceberg. They're hiding the majority of what they're feeling under the surface. And it's interesting, if you just even touch that little surface, it's very fragile. So we have to be careful as well how we approach grads so that they can preserve that emotional barrier that they need. I hope I'm not going too quickly through the slides, and I hope I'm not spending too much time on them for those individuals who've heard all this before. But I kind of want to talk a little bit now about how this current climate of COVID-19 is influencing, or can or will influence, the new grads' experience of professional role transition. And I want to start by just talking about some of the research around new graduate error. Where are the problems coming from when it comes to the practice of a new graduate? And the first and foremost are medication errors. And a lot of these, again, are connected, right? The inability of that graduate to think critically because, first of all, they're very stressed. And secondly, they don't have a lot of patterns. And this is where Benner comes in as well. Benner speaks about something called pattern recognition. And that's sort of that tacit element of knowledge that comes with, I've been there, I've done that, I've seen it before. And as you move forward in your practice and you move deeper into your practice, you have more of those experiences. So you generate these patterns, and you can walk into a room, and it's not in a textbook, but boy, you've seen that before. I had a perfect situation when I did my emergency room research with new graduates and their senior nursing partners. And it was actually very tragic, to be honest. And this new graduate that had this experience left her practice for a few years after this experience. So it's not to be taken lightly, but she had received a patient, and I mean, we know Emerge, it's crazy. It's not necessarily controlled. There's not a lot of consistent oversight. People are running from bed to bed, and they're not thinking about what's going on in that bed because they're just focused on their own thing that's going on with their patients. So you can hide or not be seen in an emergency room, and that wouldn't be at all surprising. So there's this one grad that got this admission, 50-year-old fellow with abdominal discomfort. And he was relatively stable when he came in. And so the new graduate had this patient, and of course he started to change. And the new graduate did not recognize the subtleties of the changes, but did know enough to say, something's changing and something feels wrong here, and try to get the attention of a senior nurse, ultimately of a physician. But every time the new graduate tried that, because of the pace with which these individuals were working, the new graduate was asked to make decisions that they just weren't capable of making, such as, do you need me right now? That's a big question for a new graduate. They can see that you have other things to do, that you're busy, that perhaps you have another emergency to deal with, which was what happened with this physician. And it made it very difficult for this new graduate to definitively, excuse me, say, yes, actually, I need you to not go and insert that chest tube in that other patient. I need you to come here because I feel my patient is crashing. So this new graduate had to wait until it was really evident that the patient was crashing. And turns out that the patient had a AAA, and their vitals were changing. They didn't look good. They were becoming more uncomfortable. Their vital signs were changing, but the subtleties were not connected to a pattern. that the new graduate recognized. Understandably, I mean, how could you recognize that? This is tacit knowledge. We don't teach that in the textbook situation. And yet when I talked with the senior nurses in that same area about that situation, they were like, well, yeah, like anytime I see a 50-year-old male come in with abdominal discomfort, AAA is one of my differentials. But it wasn't for the new grad. So that sort of gives you a sense that their critical thinking is simply not what a senior nurse's critical thinking is. And that is attributing much of the challenge to their to the errors that they're incurring. And I just kind of spoke to it, and that's this idea of the delays in patient care, and it's simply because they can't recognize or respond to changes in the need or in the condition, and I wouldn't expect them to. That's an important part of that. Other things that contribute to new graduate error are the fact that we don't, it's not simple. These patients don't come in without any comorbidities. They don't just present with one issue. They present with multiple issues usually, and they're often influencing the expression of the other issues. So it's not black and white. And you match that with hectic or highly demanding workloads, and we know, I mean, we're being asked to do more with less. Hallway patients have essentially become accepted, and just, we even identify them as part of our census, but we're not staffed for them, that sort of thing. And staffing has become problematic because we are finding the nurses are tired, and it's harder for them to come in, when we need them to come in. The other thing I want to mention here is time. And I think sometimes we believe that if we just give the new graduate enough resources, that we can solve all these challenges that they have. But we all know, I mean, every person on this call is a practicing nurse, and that it simply takes time. You have to be immersed and embedded in the experience of practice to have all of this knowledge come to you. It's not something I can just give you. So this is where education is not the only element that's important in a new graduate's overall transition experience. The thing that we've learned about error, and certainly my work with new graduates, and I think that's what's always drawn me and pulled on my heartstrings with new graduates, is that this is very personal for them. They're traumatized by what they see and what they feel. And they don't know how to deal with it. They don't know what to do with that information. And so oftentimes it's internalized. And I sent out a Facebook post not that long ago because, we're talking about what it's like to be in critical care right now, in the heat of the COVID situation. And I can remember my long career in critical care and how I never once was debriefed. I was never once, taught, given information on what to do with all these experiences of grief and trauma that I was having. And so I think about potentially the situation that new graduates might be going into and how unprepared they might be to deal with the personal nature of this experience for them. Okay, come here, little hand. Okay. So if we think about all of that, and then we think about what makes for a successful transition. Well, first of all, there is a need for us to intersect. We are together on this, education and practice. We need to be ensuring that it's not a matter of you end your education, now you start your practice, and never the twain shall meet. I do think we need more bridging between education and practice. And that's a discussion for perhaps later. Formal programs versus spontaneous or trial and error programs. So the literature is pretty clear on this. If you plan for this, you're going to have a much greater success than if you just think, well, if a problem comes up with that grad, I'll deal with it then. And that's because we know the stages of transition and we know the phases that these new graduates are going to go through. So why wouldn't we build in the supports that we know they're going to need? So that's an important piece that's come out in the literature recently. And again, one shoe does not fit all. A bundling of strategies has been found to be best. In my experience, and the reason that I'm working right now on a transition risk assessment instrument is so that we understand which of those quadrants, the roles, responsibilities, relationships, or knowledge, are causing that graduate the most angst. Because that's where we ought to be targeting our strategies. And if there are several areas, then we need to bundle those strategies so that we're meeting multiple needs. Not every grad is going to have the same kind of need or same level of need. So we need to individualize it when possible. We need to empower our staff and empower our nurses. And we know, and all of us know, that when we feel empowered in our workplace, we function at a higher level. So that's, it's not rocket science, that one. A sense of community and belonging. Who doesn't want to feel like they belong somewhere? And those of us who have had experiences where we have not felt like we belong, we didn't stay there very long. So this relationship piece is coming out really, really strong in the research right now around new graduates. We've always known, all of us on this call have known, it's all about the relationships. But for these new graduates who will have a choice as to whether or not they want to work, we need to recognize that how welcome they feel and whether or not they have personal relationships with the people in their workplace is going to matter. They talk a lot in the literature these days about village mentoring. Well, that's a term I use, but it takes a culture. It takes a lot of people to support a new grad, and the workplaces that are most successful are not dependent on one or two people. It's like, well, if Janice doesn't happen to be here, no problem. I mean, come on with me. This is about a culture of mentorship. Peer networking is something that I have a lot of experience with when it comes to new graduates, and that has to do with Nursing the Future, which was the organization that I founded and ran for over 10 years. And it was all about new graduates for new graduates. So it was all about utilizing the experience of transition in new graduates to then mentor and support their peers. And certainly individuals coming a year after them. And then they'd already been through the experience, but close enough to it that they understood it and they still had that strong sense of empathy. So peer mentoring is really important for those of you who might have an opportunity to infuse peer mentoring strategy into your workplaces. Progressive and evolving responsibility when it comes to decision making and problem solving. I mean, we have to understand that they're not going to be able to make decisions and solve problems at 2 months that they are at 10. And if we think about this, we would more closely monitor what kinds of patients they're getting, and how are we progressing them in terms of time management, skill level, and clinical complexity. So I think we need to think about that a fair bit. Remember that these are individuals who have just come from, oh, Suzanne, I want to touch on that. Sorry, I'm kind of going back and forth between the chat. I don't know if I can give you as in-depth an answer as I would like to right now. But Marlene Kramer and I have worked together a lot. Reality shock, just very briefly, I'll touch on the differences between my transition shock theory and reality shock. Essentially, I built on Marlene's work, and it wasn't as comprehensive. It was a little bit less robust. And Marlene would be the first to say that, as she did in my book, that we really needed to have a deeper and broader understanding of what's happening, and that's what I was able to do when I built on her work. So just a touch on that. Feedback. Just remember, you guys, these are our students, really. I mean, they were a student yesterday and now they're a new grad. Well, basically, they're still a student. And so they were very accustomed to getting a lot of feedback. And that is something we need to think about, I think, in education. Are we able maybe to move them more into a self-evaluative mode rather than their dependence on us to give them feedback. That's just a comment about how we may want to construct our learning experiences for students as they evolve through their undergraduate programs. But they are accustomed to lots of feedback. And when they don't get the feedback, they'll more than likely assume they're not doing well than assume they're doing well. And so I think feedback is really important in the workplace. All right, so just in terms of a snapshot about right now, in the kind of crisis that we're dealing with right now, here are just a few thoughts on how we might promote a more safe passage for these new nurses. And I guess the start is in preparation. I know that for this particular graduating cohort, we're essentially done. But there are some things to think about as they enter this still, I'd say, relatively unstable and potentially increasingly unstable until we see the peak of the COVID situation in our various areas. But they had stunted final practicums, a lot of them. And some, you know, I know Cynthia's on the call. I know that there was a lot of variation in the way that programs dealt with these senior practicums. There were lots of variables involved, parents who were concerned that their son or daughter were being exposed to COVID as a student. And so there were lots of issues that brought about the variations in the ways that educational programs chose to deal with this for students in their final practicum. And I do think that I do think that those stunted clinical practicums, those students that chose to leave a little bit earlier, while they may have been competent, and I think all the programs needed to ensure that the students not leave their practicum until they were competent, but being competent and being comfortable are very different. And I think, you know, competence is about the lowest common denominator in terms of standard. You know, if you meet this, are you safe? Well, being safe is one thing, but feeling comfortable as you walk into that as fully responsible professional is a different thing. So I do think that those who did not finish off those practicums may be at a disadvantage when they walk into their practice areas. There's certainly, going back up to undergraduate education, preparing for chaos and crisis is not something I think that we do overly well. I'd like to see improvements in the way that we help students deal with crisis and chaos in their undergraduate programs, making them uncomfortable, destabilizing them. And there's a lot written on this, a lot lately that's been written on this, and I've taken a tremendous interest in it because I think that we are afraid to push students because they, you know, it's warranted because we're seeing high levels of stress in students that we've just not seen before. And how do you manage that when on the other side you're saying, but you know, this is nothing. I mean, you're going to have a lot of chaos and a lot of crisis in the workplace. How are we going to prepare you for it if we don't start now before you graduate? So I think there's discussions that need to be had on that. And there's a lot of thoughts out there that we need not be as afraid of the students' stress as we are. We have to support them through it and give them strategies to cope with it and mitigate it, but avoiding it is not helping them. I think in the preparatory phase, students need to understand what the transition experience is going to be like, and we can do that in a variety of ways. I don't understand still why we don't utilize alumni and faculty more to support the bridge to practice. These are people that oftentimes the students have learned to trust, and yet we sever those relationships after they're done their final practicums. And I wonder if there isn't something we might be able to do to bridge that a little bit better. We do know that there's growing workplace tensions in this COVID situation. I think they're getting a taste in their senior practicums of a reality that they don't necessarily know how to deal with, like the lack of PPE. And my concern with even my senior practicum students was that they were already starting to normalize those kinds of lackings, those resource issues, because that's how we often cope with things, is we normalize it so that it doesn't cause conflict for us. In the first stage of transition, I do think we need to remember to evolve these new graduates slowly, help them to manage the stress, reaching out and talking to them. This is a time when they should be given permission to learn, and that we need to be aware that their performance is under stress. That is not the kind of performance you're going to see in 4 months or so. They do have a lot of questions that they're not verbalizing. So if you are in practice, for those of you on this call, be aware that the majority of what is going on for that new graduate is going on inside their head, not visible by their hands. And it's interesting, you know, they're so focused, and so are we, on watching what they do, but we ought to be really concerned and focused on watching what they think. If we can turn unknowns into knowns for them, that's really helpful, because it's those unknowns and it's the uncertainty, you know, that we're all living with right now that's causing a lot of us angst. And the same goes for them. So any unknown you can turn into a known is helpful. I strongly discourage overtime in that initial stage of 4 months. And if you can allow them to see similar people and perform similar tasks, it's a matter of getting to know those and feeling comfortable with the familiarity. The second stage, really, you guys, is about exhaustion. These grads have been head down for 4 months, and they are emotionally, physically, socially, and intellectually exhausted. And this is when I really encourage them to separate, and they are separating from their workplace. They have an understanding that they need to separate from their workplace in order to, you know, keep their sanity and get perspective on things. And I think if we are able to anticipate their doubts about their decision to be a nurse, because they've seen a lot in the last 4 months, and they're going to see a whole lot if they're up to their neck in the COVID situation. They're going to see things that they never thought they would see, and they don't necessarily have the colleagues around them who can talk to them about that. Their colleagues are tired. Their colleagues are feeling exhausted. So what does that mean for the questions that they are having about their own decisions in practice? The crisis of confidence I mentioned occurs at around 7 months. It's pretty consistent, and the literature that we just reviewed was quite glaring about it. So no one knew what it was, but they're like, at about 7 months, the grads are really in a bad way. So keep an eye on them at that 6 to 8 month period. Connecting them with stable and positive colleagues at this stage is really important, and understanding that they need to recover from that initial stage. The last stage, if we do it well, is a good stage for them. If we can channel their energy at this point into action, they'll feel productive, and they'll feel like they're moving forward. You'll find grads in this stage starting to think about, well, where am I going to go next? And I think that's problematic for workplaces, because you don't want the new graduate to leave. You just spent all this time investing in them and committing to them. So I think understanding where they're at and finding ways within your own areas that you can give them greater levels of responsibility while being a bit careful about charge and things like that. And I know grads are being put in charge at outrageously early periods, and they may manage that, but I can tell you it's not necessarily a safe decision when it comes to quality patient care. And again, you know, if you don't know what your grad's thinking in this third stage, you may very well lose them, because they're making plans and you want to know what those plans are. So what do they need? This is my last slide, you guys. It's, I mean, if I bring it right down, they need support, and it needs to be structured. And that's something I really learned in this last research project. Is I structured all of the activities and the mentorship relationship around the stages of transition. And there was a tremendous amount of uptake on the fact that, yeah, that's exactly where I'm at right now, and that's what I want to talk about. I don't want to talk about that because I'm not there yet. So that's really helpful, and I think people need to understand the stages of transition and the fact that those graduates are evolving in their thinking and their practice, and that takes time. I'll come to that in a second. Connection is critical. There's no way we can transfer tacit knowledge unless we have a relationship with each other. And so a supportive relationship that allows them to feel embraced and supported, that allows them to get constructive feedback, because I don't want everyone to tell them how well they're doing all the time. They would like constructive feedback. But this is where you get that tacit knowledge transfer. Oh, you know what? Yeah, I know. It's not a pattern that you might have been taught in your education, but here's the pattern that sometimes happens with this kind of a scenario, and this is why it's a pattern. And next thing you know, that graduate has adopted that knowledge pattern, and the next time they see it, they'll know it because of the transfer of tacit knowledge from that expert practitioner. The last thing is time. I mean, they simply need time to be in practice under controlled, scaffolded, and safe conditions. And that safety is both emotional and physical and intellectual. Scaffolded simply means that if you are aware, and this is where a lot of Benner's work can come in as well, that they are able to do the following things as they move from beginner to expert, then you won't expect them to be an expert when they're actually in the proficient stage, and progress them appropriately. Well, that is what I have. Thanks so much. I know that it's 12:56, but I wanted to entertain any major questions that I might not have touched on. Clemence, did you want to have me answer?
Yes. I have. Thank you very much, Dr. Judy. We had some. I had some question that you didn't. Someone asked you to repeat when you compare Benner's theory with yours. You mentioned that Benner's was relational and something else, and earlier in the question, someone asked you to complete what was the second term that you used, if you remember.
Yeah, no, the reason Patricia Benner and my theories work well together is that mine is more about the experience of transition, and Patricia's work is more on how practitioners evolve in their skill acquisition and their cognitive processing. So that they intersect because how they progress in their cognitive and skill practice capacity is related to their experience of transition. And so you really need to understand both. So that's what that was about. And there is an article that speaks to how to use those together.
Thank you. That clarify. I'm sure the person who asked the question could type a comment about it. And I was wondering myself if you mentioned that the new graduate can take time.
They missed that. You were talking and then it got cut off, Clemence.
Will prefer to work part-time as opposed to full-time, and then it will make a difference in terms of the 4 months versus the 8 month. Do you think, and then you meant, oh, I'm sorry. I was referring to the fact that you mentioned at first that the new graduate would prefer to work part-time as opposed to full-time. And then later on, you mentioned that the degree of stress in the students and the new graduate. Do you think there is a type of a cohort effect? Because there is a lot of talk about the new graduate, the new students are different from the previous ones.
Move through the system. So I think that's all we do need to have a sense of the differences between the generations and the way that they process information, the way they think about life. I'm not saying that all of them are wanting part-time work. No. What I'm saying is that some of them are using part-time work as a way to not expose themselves to that which stresses them that much. So I feel like we need to, in some ways, encourage them to work a little bit more than part-time, um, because I don't think that they get immersed. And yet I'm not sure that full-time in a really crazy environment is good for them either. And again, you'll get variations, you'll get people who cope really well in those kinds of situations, but they're outliers. I think the main new graduate is coming in and would do well to work about a 0.75. You'll find that if they're trying to hide or escape, they'll want to work nights only. And that's problematic because a lot of the real chaos is occurring during the day. And that's when all the supports are around as well. So keeping an eye on grads that are working just nights and encouraging them to, dip their feet into the day pool. Yeah, so I don't know if that sort of answered that, Clemence.
Yeah, it does answer part of my question because another one is emerging in terms of you seem to suggest that the shorter the first period, the better it is for them. Do you have any evidence to support that the more we put together the good condition and then it stick to the 4 months as opposed to an extended period?
Because I'm not sure I
Do you
understand
have
the question.
any
Sorry.
support from your research that would say that it is better? Yeah, because you seem to suggest that they have to immerse themselves and then to maybe get closer to the 4 months for the first stage. Is it because you think it is better in terms of retention in the profession, decreasing their stress level, building their nursing skill? Is there any benefit for them to emerge
Yes, I actually
themselves
think so.
fully and
So let me
stick
be
to the
very
4
clear.
months?
If I haven't
You're
been,
not saying
I do
it
think
clearly,
that
but I
graduates
get a
who,
sense that you would
dive in
prefer
and are
that.
immersed in their transition experience generally transitions more smoothly and more quickly. Now, that I'm not sure that they need to work full time. I don't think that they should be immersed in a highly stressful, tense environment. It's not one of those that throw them in there and make it as tough as possible, and then they'll do a little bit better. I don't think that that's the case at all. And my research definitely demonstrates that
No.
that those who have immersed themselves in the experience and are well supported do better.
Okay.
I
Okay.
absolutely
I have
do.
two more questions. Susan
The
Campbell
boomers
is
who,
asking, do you think the
I don't
present
know, like
generation
went
is
from
more
boomers to
aware of
Xers to millennials.
work-life balance?
And right now we've got the millennials in the workplace, and we've got a new cohort, the Z generation, and name a whole bunch of different things, coming in, actually graduating probably now. And I do think that they have a far different sense of the way that they want their lives to be. They do want that work-life balance, and I'm not sure that they're as willing to tolerate poor working conditions, poor relationships. They're going to look for jobs elsewhere, and that may be because of the generation. It may be because of the availability of work. But I definitely, I think it was alarming in this current research project that I did, how many of the grads were wanting to make sure that they found that balance, and it wasn't a focus for them. The transition and being a professional nurse was not their primary focus. It was like, I want to now have a life. Yes, as Barb Fagan says, work to live versus live to work. Exactly.
Okay.
Well, that's a really good question, and I think that what constitutes reflexive practice is an important thing to determine, because I think that there's a lot of variation in that concept. In this particular study, there was a lot of reflection.
Yeah.
And I haven't even touched on that
a little
data.
bit above,
There
Lisa asked a question. She's curious about the use of reflexive practice with new grads to facilitate connection, feedback, and making the unknown known. Did your research identify strong reflexive practice as supportive to successful transition or decreasing stress or any of the other harmful effects?
What was going on in that particular stage for them? And they all felt that facilitated their transition. Whether I'm able to quantify that, I don't think that I would be able to do that.
No, that's okay. I think we're 5 minutes later than we're supposed to, so I would like to thank you again, Dr. Dukeshire, for this wonderful presentation, very clear. And as you can see, a lot of people wrote thank you comments on the website. And thank you everyone who participated today. Please note that the recording of this session will be available on CASN YouTube channel and circulated to you in the coming days. Please feel free to share the link within your networks. And thank you again, everyone. CASN certainly hopes you will consider attending the last session this May of our 2019-2020 Lunch and Learn series with Philippe Voyer, who will speak to priority number 6, nursing care, quality improvement, and patient safety.
Take care, everybody.
Just as an aside, Philippe Voyer is an expert in gerontological nursing in the province of Quebec.
Thanks, Clémence. You did a great job facilitating.